We're going to talk a little bit about our new book. And Ing-Britt, you start?
Okay.
Our book then is about Cambodia and Cambodian society from the from the perspective, I would say, of medical anthropology. And I think that for most people in all societies, issues surrounding issues of health and illnesses are of central concern, and therefore I think that ideas that people have of such matters may also tell us something about the ideas they have of their society. We are dealing with two different sets of ideas with regard to health and illness. The first one being the biomedical system implanted by the French colonial government, and the other one, of course, the indigenous health cosmology of the Cambodian people. I think both these systems have coexisted in Cambodia for a long time, for more than 100 years. And actually they are still an option, both of them, when it comes to medical care for today's population as well.
Okay, much of the time after the Cambodian independence in the 1950s was characterized by political upheavals and associated violence. Not least the Pol Pot regime of the late 1970s was a period that devastated the lives of a great many people. We know that armed conflict has often lifelong negative consequences for people's mental and physical health. And the same is true of involuntary displacement. And these consequences hit both combatants and bystanders. During our conversations and interviews with the survivors of the Pol Pot regime, we have found this to be particularly true in Cambodia. Not even that, but nowadays the growing inequalities, socioeconomic inequalities in Cambodian society under neoliberal globalization is another hazard that has affected primarily the health of poor people. And even though the Ministry of Health in Cambodia is making a lot of effort, serious effort, to get the public health system going, it is still true that your chances of getting adequate medical care are less the poorer, the less educated you are, and the further away you live from an urban center.
So, doing research for our book in the field, and also in the archives and in the scholarly literature, has actually been an intellectual, a social, and sometimes even an emotional adventure. But we have tried to convey our experiences and also, I think, the knowledge we gained in the process to our reader. And I do hope we have succeeded.